The normal adult heart rate is? Answer is B, 60 to 100 beat per minute. Which electrolyte imbalance causes tall peaked T wave on ECG? The answer is B, hyperkalemia. The antidote for opioid overdoses? The answer is B, naloxone. The functional unit of the kidney is? The answer is option C, nephron. Which vitamin deficiency causes night blindness? Answer is A, vitamin A. The normal adult respiratory rate is 12 to 20 per minute. The first heart sound S1 is due to closure of mitral and tricuspid valves. The universal blood donor is O negative. Which vaccine is given intradermally? Answer B, BCG vaccine given intradermally. The normal blood pH is? The answer is B, 7.35 to 7.45 is the normal blood pH. The causative organism of tuberculosis? The answer is C, Mycobacterium tuberculosis cause tuberculosis. The normal platelet count is? The answer is C, 1,50,000 to 4,50,000 is the normal platelet count. First priority during CPR is? The option is C, circulation. As per new guidelines, circulation is the first priority. Which drug is used in anaphylactic shock? Answer C, adrenaline is the injection used in anaphylactic shock. The normal fetal heart rate is? The answer is C, 110 to 160 beat per minute. Which cranial nerve is responsible for vision? The answer is B, optic nerve is the second cranial nerve which is responsible for vision. Which vitamin is essential for blood clotting? The answer is D, vitamin K is essential for blood clotting. The normal adult oral body temperature is? The answer is B, 37 degrees Celsius. Which organism causes typhoid fever? Answer is A, Salmonella typhi is the organism causes typhoid fever. Insulin is commonly administered by? C, subcutaneous route. The antidote for heparin is? The answer is B, protamine sulfate. Which electrolyte is the major intracellular cation? The answer is B, potassium is a major intracellular cation. Which chamber of the heart pumps oxygenated blood to the body? The option is D, left ventricle pumps the oxygenated blood to the body. The Glasgow Coma scale maximum score is? The answer is C, 15 is the Glasgow Coma maximum score. The single most effective measure to prevent hospital-acquired infection is? The answer is B, hand hygiene is the most effective measurement to prevent hospital-acquired infection. A patient with respiratory acidosis is expected to have? The option is B, increased PaCO2 level and decreased pH. Which electrolyte imbalance is most likely to produce U wave on ECG? Option is B, hyperkalemia. The antidote for warfarin toxicity is? The answer is B, vitamin K is the antidote for warfarin toxicity. Which drug is the first-line treatment for anaphylactic shock? The answer is C, adrenaline is the first-line treatment for anaphylactic shock. The normal central venous pressure is? The option is B, 3 to 8 cm H2O. Which microorganisms commonly cause hospital-acquired urinary tract infections? The answer is B. Escherichia coli. The Montague's test is used to detect. Answer is B. Montague's test is used to detect tuberculosis infection. Which cranial nerve controls facial muscles? The option is B. Seventh cranial nerve, facial nerve is control the facial muscles. The earliest sign of hypoxia is B. Restlessness. Which valve lies between the left atrium and left ventricle? The option is C. Mitral valve. Which vitamin deficiency causes megaloblastic anemia? The option is B. Vitamin 12 deficiency causes megaloblastic anemia. A patient with blood group AB positive is considered. The option is B. Universal recipient is considered as AB positive. The most common complication of prolonged immobility is. The option is B. Pressure ulcer or bed sore is the most common complication of prolonged immobility. Which electrolyte is primarily responsible for neuromuscular excitability? The option is A. Calcium. Which insulin has the fastest onset of action? The option is C. Insulin Lispro. The normal cerebral spinal fluid is B. Clear and colorless. Which vaccine should not be given during pregnancy? The option is C. MMR vaccine should not be given during pregnancy. A positive Chostek sign indicates. Answer is option B. Hypocalcemia. The nurse should administer digoxin with caution if the apical pulse is. Option is C. Below 60 per minute. Which condition requires airborne precautions? The option is B. Pulmonary tuberculosis requires airborne precautions. The most common site for intramuscular injection in adult is ventrogluteal. The most common site for intramuscular injection in adult. During CPR for an adult, the recommended compression depth is. The option is C. At least 5 cm, about 2 inches. Which hormone is secretly secreted by the beta cells of the pancreas? The option is B. Insulin is secreted by beta cells of the pancreas. Which laboratory test used to monitor long-term blood glucose control? The option is C. HbA1c. The best position for patient in shock without spinal injury or contraindication is. Trendelenburg position is the most effective position for the patient in shock. Normal central venous pressure is. The option is B. 5 to 10 cm H2O. Which chamber of the heart has the thickest wall? D. Left ventricle has the thickest wall. The normal cerebrospinal fluid is. The answer is C. Clear and colorless is the normal cerebrospinal fluid. Which disease is caused by deficiency of iodine? The answer is A. Goiter caused due to iodine deficiency. The most common site for pressure ulcer is. The answer is B. Sacrum is the most common site for pressure ulcer. Which cranial nerve is responsible for hearing? Cranial nerve 8 is responsible for hearing. The normal fasting blood glucose level is 70 to 90 mg per deciliter. Which microorganisms commonly causes hospital-acquired infection? The answer is A. Pseudomonas aeruginosa. The primary purpose of hand hygiene is to. The answer is option B. Prevent transmission of infection. The best site to measure temperature in an unconscious adult is? Option is D. Tympanic is the best site to measure temperature in unconscious patient.